HLGMN.
Hello again, it's Harry here, your geriatric nurse from Toronto, Canada, back for my humble contribution for the care for the older adults and their caregivers. Tonight, I just wanted to briefly discuss about atypical symptoms and what it means for the geriatric care. And so, in nursing school, we were taught about classic signs and symptoms for every disease. Like for example, if there is a urinary tract infection going on, there may be frequent urination, painful urination, and things like that that goes along with that disease. In the older adults, instead of feeling those signs and symptoms that we typically see in regular adults, um, they have atypical symptoms, which means instead of having those symptoms, they would instead start being confused, or they may start falling, or they may be just hypoactive or sometimes hyperactive. And it's very important to know the onset of when these things start, especially if someone is living with dementia, because again, we are gonna have to go back to the triple D's to make sure you find out which of the triple D's is in play, so you'll be able to intervene accordingly. So again, when you notice these changes happening, make sure you take a note of them. Remember when things happen, what works, what doesn't work, because these may be signs and symptoms of a medical emergency that needs prompt attention. So do not self-diagnose. That's why it's very important to always have your regular checkups, always take your medications as prescribed, live a healthy life, like having good rest, balanced diet, exercise, and having fun as well. There's a very fine balance of everything, so that these signs and symptoms won't happen. But if they happen, just make sure that you're on the guard by noting when they happened, how often they were happening, and so that when you go to your primary care provider, you'll be able to give them the most accurate information, so they'll be able to intervene accordingly. Um, Thank you so much. Hope everything is